Hello, everyone, and welcome to the Security Nurse Podcast. Today's episode was one that I've been looking forward to, and though not a common problem in healthcare, it is one that can be very damaging. Today, we are going to talk about stalking. I'm joined by Dr. Nathan Brooks, a forensic psychologist and senior lecturer with extensive experience in high-stakes behavioral assessment and intervention. With a career spanning both public and private sectors, Dr. Brooks has worked closely with government and law enforcement on sensitive cases involving threat and risk matters. We discuss an overview of stalking, how it can occur in healthcare, what threat assessors can do, and the importance of trauma-informed care for both victims and perpetrators. This is an important conversation, and I would appreciate any support you can give in sharing the episode, liking, and subscribing. Let's get started. Well, hello, everyone. I'm joined today by Dr. Nathan Brooks, a forensic psychologist based out of New Zealand. Nathan, thank you for being here.
Thanks for having me, Sarah Marie.
Yeah, it's morning for you and afternoon for me, so there's quite a time difference there. I appreciate you getting up early in the morning to be on the show.
Yes, luckily I have coffee, so that always helps.
Feel free to sip away. Well, I wanted to start off giving our listeners a little bit of a background of kind of who you are, what you do. But then also, I like to ask every guest, what was that aha moment that kind of put you on the trajectory to doing what you're doing today?
Ooh, it's a very probing question to start with. So I've been a forensic psychologist for, it must be coming up 14 years now. Started out in Australia, I trained there and then began working and practicing in the field. I did a very broad array of work to start with, from people that were everyday offending, substance use, through to more serious offending, sexual offending, violent offending. And while I was doing that, I was seeing around sort of 30 or so clients a week in a private capacity. And then I also was doing my PhD on the side in psychopaths or psychopathy, and that probably was, I guess, the aha moment in many ways, working with
Okay.
these individuals that really departed from the norm. They did everything different to everyday folks. They thought differently, they acted differently, they were very calculated, and that really captured me. It was very intriguing, and it really put me down the path of, I guess, becoming more focused on the high harm, high risk type of offender. So, yes, then I progressed after I did my PhD into working in the sexual offending space with quite serious sexual offenders. I did that for a few years, and then had a brief stint lecturing, and then I've recently been in the police for around about the last 5 years in a operational capacity, essentially kind of consulting on police investigations. And then I do continue to do consultancy work on the side as well, around particularly threat assessment aspects.
Wonderful. Yeah, and that's kind of like how I found you, was on LinkedIn and through somebody that I'm connected with through the Association of Threat Assessment Professionals. And luckily you were available today to chat. So that is like really intriguing, and I can totally see how being interested in kind of the deviation of the norm, right? And that leading to what you're doing today. And I think today we kind of landed on the topic of talking about stalking. And in healthcare, out of healthcare, it weaves together. We'll find our way here. But in some of the research that I was doing in regards to healthcare professionals experiencing stalking, I found such a wide variation of like 6 to I think 53% of healthcare workers had reported that they had experienced stalking. And they said that the reason for that was the inconsistency in the definition of stalking. So I think that's really going to be a good place for us to start. What is the definition of stalking? What are the characteristics?
Yeah, stalking for me, I'll just sort of take a slight side departure for a minute, but stalking for me really is a form of targeted violence. And targeted violence is really this offending that's directed at a specific victim or someone that might bear some similarities to a victim. So it has some symbolic significance to the offender. And it's often motivated by factors such as grievances, fixations, obsession, a desire for sort of retribution. And within that targeted violence space, we can get types of offending such as stalking, domestic violence, threats to kill or threats to harm, and then also those that want to carry out mass casualty events. And so within that, as we sort of narrow down from that targeted violence spectrum, we find that stalking specifically really relates to intrusive, unwanted acts that occur on at least two or more occasions, and they create apprehension or fear in the victim. And that apprehension and fear is really important because that's where the definition can get a little bit fuzzy sometimes. We can go, well, people are making unwanted contact, but it's got to be causing a response in the victim, and that is part of how we measure that definitional aspect.
Yeah, I was gonna kind of ask that clarification on violence because I think so many people get just so focused on violence as physical and not really incorporating the emotional, the psychological harm that some of these acts can really do. Can you kind of expound on that?
Yeah, and the distress part, I guess, coming back to that for a second, social media, people are often making repeated contact and it might be unwanted, but it's not causing distress in the victim. So we can see, like in the online space now, that unwanted repeated contact can be very frequent, but it may not meet the definition of stalking unless the person's becoming distressed. And then, of course, we can get a whole variety of in-person type behaviours where it could be things such as dropping off gifts at the person's doorstep or unwanted letters, a variety of different ways, sending things to their workplace, or it could be at the physical level where we see people that are actually in person, following them, watching them, observing them. So stalking can be very multifaceted, and then of course we get a bit more refined in terms of aspects such as people trying to enter into ex-partners' houses and leave things inside and really sort of torment and try and, I guess, impact their general well-being.
Just so it can be a little bit kind of subjective in the sense of, it's how it's perceived as well, which I think would make it very difficult for law enforcement or anyone in a professional capacity that's investigating stalking to really get the full gamut of things, right? Like I hear so much of stalking victims, like they're involved in these cases for 7 years, just kind of ongoing because of the nature of it, right?
Yeah, what often can happen in situations is that behaviour is looked at in isolation. So someone contacts the police and it's a different set of police officers that come out. They look at that incident, they see that it's not potentially at a somewhat serious threshold, and it gets filed away. And then again, something happens, a different set of police officers come out, and it's not viewed in its entirety. The whole picture's not connected together. And that's where stalking legislation and laws have become really effective, in that they have allowed the right people, particularly threat assessment practitioners, to come in and start to connect the dots and link the behaviours together and see it for what it is.
Gotcha. So, that I was going to ask you maybe that a little bit later on. A lot of the laws are starting to change as the understanding of the nature of stalking and how that really works. Can you speak a little bit more to kind of each of those factors? I know you talked about kind of the obsessive, obsessed with the person, or maybe like attachment styles, something like that. Can you break down those a little bit more?
Yeah, probably the best guide, at least the one I tend to work off, is the work of Paul Mullen and colleagues in the Stalking Risk Profile, which has 5 typologies of stalkers, and it really looks at the victim offender relationship. So we've got the rejected stalker, the resentful stalker, the intimacy seeking stalker, the incompetent suitor, and then also the predatory stalker. I'll just sort of run through them. So the rejected stalker, really, it often occurs following a relationship breakdown, or it might be something at work where the person feels rejected by a colleague, and that then forces them into trying to reconnect that attachment in many ways. So they're often trying to re-establish that relationship, and they can be quite resentful at times, but it's more about repairing the relationship rather than necessarily harming the individual.
Mm.
But it can be quite persistent. So that can be, bombardments of communications, turning up at people's houses. So they can be very persistent, and then if they do feel as though that they're not going to be able to repair the relationship, then it can escalate in seriousness. And then we have the resentful stalkers, so the type of individual that might feel that they've been wronged or humiliated by someone.
Mm.
Again, it could be in the context of the workplace, which is one of the main areas where we see stalking can arise alongside intimate relationships. And they'll harass victims, and can be intimidation, threats, in some ways trying to make them experience some of that suffering, or that emotional
That
suffering
they,
that they
that,
have had. Yeah, and that can, again, be in an array of contexts where we can get that victim-offender relationship. And then we have intimacy seeking, so really the stalker's wanting a close connection with the person, often of course romantic, and they believe that the feelings are reciprocated, which they're not, or there may have been an initial interest, but then it's not reciprocated, so then they continue, and they, love letters, gifts, messages, all sorts of unwanted contact. And then we have the incompetent suitor. So that's really someone that is, again, wanting an intimate connection, but they just don't have the social awareness that there is absolutely nothing there. And so I've seen many of these cases where, people are approaching females that are working in the retail setting at stores, and they just continue to turn up at the workplace because they've smiled at them when they've served them in the context of sort of that customer shopper interaction, and the person misperceives those signals, and then they keep turning up and they think that there's a romantic interest there. And they're really individuals that are lacking in those social skills, and they just completely misinterpret the situation. And then lastly, we have the predatory stalker, who is someone that's much more targeted. They're quite serious in trying to sort of control and really dominate the victim and impact their sort of way of living and their livelihood. And it's often, there can be quite a sort of sometimes sexual overtones to this, or even violent overtones as well. So they might do a variety of sort of surveillance type of behaviours and approach behaviours, and it can be a very, very sort of intrusive type of stalking. So it's very instrumental and calculated, but in saying that, that doesn't mean that those other types of stalking motivations are not always instrumental either. So,
mm.
stalkers can vary in their capacity and competency to stalk, and the types of tactics and things that they'll employ.
Kind of healthcare, and talking about healthcare and bringing that in for a second. What are some of those characteristics that we would see maybe of a stalker who is decided to target a healthcare professional?
Oh, look, they're not really that. It's not really that different from many other settings. But of course, it is important to understand the context of the victim, and how that has come about. When we think about healthcare, healthcare it's a tricky space, and it's so multifaceted as well. So ultimately, what we're seeing is, it could range from nurses, doctors, mental health practitioners, social workers. So it is so vast and varied that, because there's so many different interactions that are occurring within that context, stalking can arise in a whole different
Yeah.
array of sort of ways. So ultimately, if we try and then boil it down, though, it's often that it's in that caregiver capacity, and there's a level of vulnerability and connection and reciprocation in those relationships. But of course, one is in a professional setting, and then the other one is that the person really ultimately is a client, but they can become blurred for individuals, and that leads them to perceive that there is a greater connection there. There may be a sense of intimacy, maybe a sense of closeness, or something that could be fostered into a relationship. So we often see that, the intimacy seeking aspect can be there, where they do have had some sort of connection with the person, maybe not at a romantic level, but certainly at a therapeutic level. And then, of course, healthcare is complex as well because there's a whole array of things that can go wrong. So we could easily get, resentful stalkers or people that are aggrieved with individuals in the healthcare sector and are seeking some sort of retribution. So that's a very roundabout answer, but I think it is a roundabout issue where it can manifest in a variety of ways, and we need to unpack the context. We need to unpack that sort of victim-offender relationship and then look at the stalking and try and understand what is the motivation of the behaviour here for the individual.
Yeah, I think, there's only so much that we can put in kind of a short time frame for a podcast, but you did an overview beautifully there. And I think, the point that I really wanted to get across is that it is so multifaceted, right? And I think exactly like you said, taking the context and looking at the context and then being able to kind of go from there is what's really important.
Yeah, and look, we do know that healthcare is a setting where stalking is more common. Roughly the figures would say that around about 30% of stalking in the healthcare setting is client on practitioner. Sorry, yeah, so an ex-client on a practitioner. And then we have around about 20% of people being stalked by colleagues, so other healthcare workers, which is worrying.
Mm-hmm.
And then of course people that are working in the healthcare sector but they are being stalked by an ex-partner as well accounts for about another 20%. And then the rest of those figures essentially are sort of strangers or acquaintances that make up the numbers. And just sort of probably rounding that out in terms of sort of stat wise, I know you mentioned before around about sort of that 6 to 50% of healthcare workers have been stalked. And I have seen those figures as well. When the studies are narrowed down a little bit more and sort of averaged out, it tends to be around about the 13 to 14% of healthcare workers are stalked. But alarmingly, when we bring that to mental health practitioners, those figures are much higher. So particularly for psychologists, about 1 in 4 psychologists are stalked by a patient, which is frightening.
Yeah, that is a significant jump. And that kind of brings me to my next question on, the mental health aspect. So, and the drivers behind that. I mean, is everybody that's stalking have some sort of mental health disorder, or, do they tend to just be the person on the street and don't really have any issues, right?
Again, it's a really tricky one. It's like talking about sexual offenders and the different array of diagnoses and factors that can drive the behaviours. Look, mental illness can be a significant factor, particularly if someone is delusional and they have inflated and become quite sort of obsessive about some of the interaction that they believe is there. So that can be quite concerning. We can get delusional individuals that will resort to violence when that interest is not reciprocated. Then there's personality factors, entitlement, grandiosity, that sort of narcissistic personality that's often associated with a lot of offending. Sometimes I think it's easier to boil it down a little bit like in the targeted violence space to things such as grievances or fixations or ultimately this desire for intimacy. So often there's a few commonalities that we see and that they're sort of the universal threads. So it often is that they want a relationship or they're trying to repair a relationship, or that they are aggrieved and they've been wronged and therefore they're resentful and they're wanting some form of retribution, or lastly, they are sort of a fixated and obsessed individual, which probably leans a bit more towards the mental illness side of things.
Understood. So when you're investigating these types of cases, what kind of information are you really looking for to determine if stalking is really what is going on in that situation?
Yeah, it's interesting. So the victim information is really important. So getting an accurate account from the victim, and sometimes there are innocuous things that the victim's not aware of that they dismiss and don't report because they think it's so trivial. So stalking has come a long way in that victims are, I think now taken much more seriously than in previous years, which is so important. So if someone makes an account, it is taken seriously, but of course we need to make sure that the victim still feels safe and then is able to give that whole account in its entirety and not worry that it might be something that they have done and therefore they only kind of give a washed down version of that. So the entirety of the account and the behaviour is very important. And then from a risk or threat assessment perspective, some of the markers that are used to sort of evaluate the seriousness of stalking are looking at persistence. So how likely is it that this individual is going to keep persisting with the stalking behaviour? Then we look at factors around the severity or the harm. So what's the likelihood that it could escalate and progress to physical harm? And then lastly, there's recurrence as well. So the likelihood that the stalking will reoccur with a different victim. So what's really interesting as well, and I don't think this is understood and probably underreported often as well, is that many stalkers will stalk multiple people, but it tends to be that we just, because stalking has been underreported, that we don't have that awareness that they've actually stalked other ex-partners or things like that before. So it can be quite a persistent, or I should say a recurring behaviour that occurs across different victims and different contexts.
I have a question about that later on, actually. I have that written down. But my first question, or my next question is, you mentioned kind of getting that whole picture from victims, making them feel comfortable and being able to share, the whole kind of story. And this question is for someone, if you think that you are a victim of stalking, what is some of that information and maybe some of those behaviors and cues that we can make people aware of to kind of pick up on?
Yeah, it's a good question. I think the whole account of the behaviour is important. So I always go back to the victim perspective because that is the person that is going to give us or provide us with that whole account. So it's timelining the behaviours basically. So rather than just getting an account of the incident, it's provide me with a complete timeline of everything and anything that has occurred with this individual. It might be over the past 12 months or from whenever there was first contacts. I think tracking and charting a timeline of behaviours is very, very important because that allows us to then step back and see the entirety of it. A big question threat assessment practitioners need to try and ask is, why did the stalking start and why is it continuing? So I think that is an aspect that will help us understand the motivation and help us understand about the level of seriousness. And then of course, some other aspects that are also quite crucial are victim vulnerabilities as well. So, and this can be unsettling. I always equate it to, you get on an aeroplane and you're told about putting on your life jackets and where the exit rows are and all those sorts of things in the worst case scenario. And unfortunately, we need to have those conversations with victims as well around what's going on in your life, where are you exposed and where are you vulnerable? Because if we don't, that is when we can get the worst case scenarios happen. So we need to be doing, I guess, safety practices and threat assessment practices with victims to make sure that we're aware of vulnerabilities in their life where the stalking may continue or where they may be being surveilled. So all of that, I think, is important information to garner to make accurate sort of assessments and understanding about the stalking.
So I think when you're talking about it, you're talking about like physical security and then even like cybersecurity, like where are you vulnerable, maybe even online, and that sort of thing, correct?
Yes. What coffee shops do
Okay.
you go to? What coffee shops do you go to?
Your
What
routine.
routines? So, and again, bringing that back to healthcare, that can make healthcare workers quite vulnerable because, for instance, they run a private clinic and they are there from 9 to 5 every day. So their routine and the predictability about that makes them, quite easy to stalk in some aspects for someone that is aggrieved with them, for instance, because they know where they will be. They know if they wait around long enough, they'll spot them, they'll catch them, they can leave a gift there or an unwanted letter. So you've got the routine aspect that's challenging, the physical location of their practice. Some of those things can expose sort of healthcare workers quite a lot because there's consistency in what they're doing, and that stalkers love consistency.
Yeah, well, and it's not just that, it's the accessibility, right? And so, accessibility comes, you want people to be able to access health care and get that taken care of. But at the same time, somebody in that has this mindset can exploit that accessibility, right? So I don't know how things are in New Zealand. I'm assuming it's the same in the US, but we have, you can't turn somebody away when they come to the emergency room, right? If they say that something's wrong with them and they're seeking care, you have to let them into the emergency room and provide that care for them. So that definitely makes somebody, especially in the emergency room, a lot more vulnerable to someone that may want to stalk them, right?
Yeah, absolutely. And there's obviously obligations that hospitals and various healthcare sectors they have to follow through with that, even though it may be persistent and unwanted. And look, that is a challenge that I guess emphasises why healthcare, whether it's hospitals or sort of district boards or things like that, do need, I think, threat assessment teams, because there are going to be difficult individuals, and I don't think that's been widely adopted across the healthcare sector yet. I think threat assessment, and it's traditional security. We have staff that secure the actual physical premises, but how we're making assessments and evaluations of people that present concern to our staff and our personnel, there's a long way to go with that. And then, of course, the broader context as well, in terms of people within the workplace that might be harassing other colleagues or potentially even stalking them. That's where threat assessment can be quite vital. And we've seen instances over the years where workplace stalking can be very fatal.
Yeah, in regards to, in the hospital with patients, and you're absolutely right. Like, those threat assessment teams have not been very widely adopted or implemented yet, but from what I hear, those healthcare systems that are implementing them are having a lot of success with them. And having a team like that allows to create maybe care plans, right, for these people. So maybe they do show up to your emergency room, but about this stalking behavior. It's alerted in the chart. The staff member that they're targeting. You can make a safety plan to protect that staff member, but then also have a plan in place for the patient. And actually this leads into a question, just very structured care, right? And so one of my questions for you is, actually, I hear mixed things, like victims being told, don't cut off communication because you might upset the stalker and then things are going to escalate, or, no, be very blunt, very straightforward, cut it off, don't have any more contact with them. So I know that was like a threefold question there that kind of ties into what kind of structured care to have for those types of individuals when they come into the healthcare facility.
Yeah, look, there's no magic answer around what to do. It needs to be considered in each scenario. In saying that, though, there are some good guidelines and parameters. So just first of all, we know that if stalking is stopped within the first 2 weeks, that the outcomes are very positive. So generally, stalking that goes beyond the 2 week mark becomes more challenging, and that indicates the persistence. So if it's stopped and there's an intervention point within the first 2 weeks, then often that will be it. It will end there. Once it goes beyond that, we have some more challenges. So there's some work that's been done by Spitzberg and QPAC, and they've talked about 5 different sort of methods that can be adopted with stalkers. So these are things that the victim can do that may fuel things or potentially stop things in their tracks. So they talk about moving towards, moving against, moving away, moving inward, and also moving outwards. Moving towards would be things that are really the victim employing efforts to move towards the stalker. So that would be trying to reason with them, engage with them. It might be arguing, disputing things with them. Probably not the most effective. Moving against are really, essentially, it's like a counter attack against the stalker. So we're talking about they might retaliate back and try and engage in acts that will demean the person, cause them harm, damage their reputation. But in saying that, it can also be proactive things like filing charges. There's a balance point there. We need to make sure it's the right moving against. So moving against that will protect the victim rather than incite further problematic behaviours from the individual. We've got moving away, which is ultimately stopping things, so ceasing any engagement, so moving away from that individual. So stopping contact or avoiding any contact with the stalker might be changing routines, could be changing your residence, changing your phone number, so those sorts of things that are going to make it harder to have contact with you. Moving inwards, so essentially that comes back to me and focusing on me as the victim and doing things that will empower me as an individual. So that might be going and seeking counselling. It might be taking on self-defense classes. Over in the US, it might be carrying a gun.
Yes.
So there's sort of things that will empower the person. And then moving outward, which is looking in your sort of outer circle, who can give you support. So it might be, seeking guidance and assistance from others, so friends, family, and so on. So there's a variety of sort of options, and what we generally say is moving away is very helpful. It sort of stops things in its tracks. It makes it harder harder for the person to get reinforcement by stalking you because they're not getting anything back. And typically, the moving towards is not ideal because it's very hard to rationalise and reason with a person. Yeah, look, and moving inwards can be obviously quite helpful as well, focusing on you and what you can do for yourself to give you a sense of, a greater sense of sort of empowerment and control. I think that's really important.
And I really like that because I actually had a question for you because I was listening to your podcast that you did with Joe Saunders, and that was on the lone actors. And you had talked about, lone actors kind of being the main character in their story, right? And I kind of see some parallel to stalking and being the main character in your story and how that can also empower. So when you said inward, because I didn't know where you were going with this, and when you said inward and kind of the self-defense, I was like, okay, that makes sense. But it goes along with the story part too, because I had so I listened to another podcast called Personality Hackers, and it's on the Myers-Briggs, and they were talking about a book put out and Disney doing gamification, right? And so you go to Disney World and there's gamification, and it's helps lead you through the park, right? But gives you the autonomy to kind of make choices and that kind of thing. And I know this is like a big stretch, but hopefully you kind of know where I'm going with this. And so you talked about being able to stop things kind of within that first 2 weeks. And I wonder how much kind of this storytelling is involved in stopping that behavior, but then also empowering victims as well.
I think the storytelling is interesting. I'll come back to that in a second. I think the reason it doesn't get stopped in the first 2 weeks is because as a society for a long time, we haven't really understood that it is stalking. So that, I think broadly, we haven't understood that. And that's probably led to people dismissing it or being afraid of making a big deal about it and reporting it. So I think that it's that it starts and people are unsure or hesitant what to do. And then when they do finally report it, it's been going on for 6 months. And then it's a much more pervasive behaviour that is hard to stop. And arguably an intervention point has been missed. So I think that's an aspect is we just downplay the behaviour or are not actually sure that there is some more sinister intent behind it. So we might think that, and it will just stop. We might think, oh, look, if I'm polite to this person and try and manage it, that they will just eventually leave me alone. So it's just, I think for a variety of reasons that has happened. The story aspect in terms of sort of the narratives that people tell themselves as it goes on probably becomes more important. I think that is where for victims, and I do say this cautiously because I think we need to be very careful what we do say about victim responses, but
right.
Yeah, victims may lose their sense of power and that sense of control. And that's why I really like the moving inward side of things because it's just bringing it back and going, okay, what can you do for you to try and restore a sense of control in your life? Because this person is trying to take that. And that becomes very crucial to make sure that there's some viable strategies that help them with their well-being, because stalking is so effective because it's so bloody persistent. And certain types of stalkers want to eat away at the psychology and the well-being of victims. And in that, the resentful type stalkers, for instance, that becomes really important, that we are giving the victim some strategies so that they are not essentially feeling so victimized and that their well-being is not deteriorating.
No, I think having conversations like this, I mean, are absolutely like essential to this. And I think you're absolutely right in being able to identify that a lot sooner, right? It's the same thing with domestic violence. And I don't know, I know I don't share personally with you, but I am a domestic abuse survivor. So understanding kind of cautious and making sure that we frame things for victims in a way that is empowering, absolutely. And so in those parallels, it's the old metaphor of, you put a frog right into boiling water and they're going to jump right out, right? But if you put a frog in a cold a cold pot of water and slowly start to boil it, they're not going to notice it or recognize it. And so I see a lot of parallels, especially in some of this violence and in this targeted violence, is it's that slow build that can be very confusing, and it's not something that everybody studies, right? So it's how do I recognize it as a person? I know, like, I have teenage daughters. They see a lot on TikTok. I know I don't have TikTok. I'm not a big fan of TikTok, but when it comes to like kind of that education piece, like they've come to me and they've been like, "Mom, what's gaslighting?" And I'm like, you're asking me about, where did you hear this? They're like, "Oh, a TikTok video." So it is starting like some of those conversations on that early identification of a lot of these behaviors.
Yeah, absolutely. And that's where police are, I guess, quite important in this setting or in this sort of situation as you're talking about. If we can get our police to have an educational role for victims as well, to help them try and connect the dots, and make them feel as though the reports that they are making are of course valid and being heard and being understood, and then educate them on what else to look out for. That is important. But of course, I think sometimes we then always go back and put a lot of pressure on our police to do these things. So at a societal level, and podcasts like this are fantastic because we can educate people through discussions and through putting information out there around what to be aware of. So, and look, there's been some studies out of Australia, I think England and Wales recently, that government-based studies that I think roughly it was around, for those 16 and over, 1 in 7 people had been stalked. So, I mean, that's astronomical numbers, 1 in 5 females. It's at a societal level, that's hugely prevalent. And I don't think that we have any awareness of just how significant that is. We could be doing a lot more sort of public messaging campaigns around that. And then, of course, there's as you touched on, TikTok and the online footprint, which is probably just untapped at the moment. I don't think we have any comprehension of how significant some of the harassment and stalking is that is occurring in the online space. But yes, the progression of cyber stalking now, which figures would sort of say around about a third of stalking is now occurring online, and whether that is spreading misinformation, social media surveillance, hacking emails, impersonating the victim. Stalkers are becoming multifaceted, so we get it in person and then online as well. It's just a very rich environment to garner information about people, and that's led to, I guess, some different types of stalking behaviours. So we've got things such as swatting, doxing, image-based abuse, intimidation. So swatting is where we get a stalker that will make up false reports about someone. So they might say that there's a burglary occurring at the victim's residence, and what they do is essentially will try and get things like emergency services to come out, and ultimately it's about just unsettling the victim, humiliating them. They might try and make it as though the victim has made a false report to police. So essentially it is trying to draw attention to the victim in an unsettling manner. And then we have doxing, which is ultimately, publishing private information and personal information about people on forums. There was an interesting case in Queensland a few years back in Australia where an individual was going on to rape fantasy websites and posting details about his ex-partner on there over a 4-year period, and men were turning up thinking that she was, declining and having no idea about their advances because it was all part of the rape fantasy. So you can get some stuff like that that is in many ways a bit quite sadistic in some aspects. And then we have, image-based, which, gosh, who knows where we'll be in another 5 years. Deep fakes.
Scary, right?
Yeah, I mean, it can be done in 30 seconds and then distributed online. And then, of course, intimidation campaigns and things like that in the online space are, tarnishing people's reputations, which again can be so easily done and so effective. And victims are pretty helpless to do much about that. It's very hard to go and get a web page taken down that's just dedicated to you, and it's just full of lies and false information. So there's a hell of a lot to navigate over, I think, the coming years in this space.
Yeah, absolutely. And I think in that navigation, creating one, making sure that we're doing evidence-based practice, right, for prevention and investigation and that sort of thing as well, but then also creating these supports for victims and survivors, and ensuring that they're getting the support that they need and the information that they need to deal with a lot of this, because it can have very long lasting effects, right?
Absolutely. Particularly, there's been several is not the right word, but I mean, I'd be guessing thousands and thousands of cases throughout the world where, stalking has gone on for decades, and the toll of that on the person is phenomenal. It's become so entrenched, the behavior. And I've seen cases that have gone on for 20 years, and I don't know where we even start to try and understand the impact that would have had on the victim. At the same time, taking a step back, and you imagine what must be going on for a perpetrator to be that preoccupied with a person for such an extensive period. Clearly, other things are not developing in their life, and that person is in many ways the reason that they wake up each day, which is very unsettling. And then you try and consider, well, how do you start? What's a circuit breaker? How do you change that? Because normally, if something has gone on for that long, there has been multiple intervention points, and they're not failing. So that's very, very troubling.
Yeah, and that was actually one of my questions, because, and this is in any kind of behavior, right? You if you want to change a behavior, whether it's, just a benign smoking or something like that, then you have to replace it with something else, right? And so, and correct me if I'm wrong, but in some of this stalking behavior, I mean, this behavior maybe becomes a coping strategy for something that's going on in their life. This behavior becomes so entrenched. What are you going to replace it with? How do you change that behavior, right?
Yeah, it's really tricky. There's a very nice model in trying to change offender behaviour by Tony Ward, actually a New Zealander, and it's called the Good Lives model. And essentially, I mean, the easiest way to explain it is it's what are the ingredients that we need to have a good life, and it's working through those. Because look, targeted violence in many ways is a maladaptive response to something that's going on in the person's life, and then bringing the Good Lives model in is about looking at what function is this behaviour serving. So we all have core needs, and ultimately stalking or offending behaviour it's serving some need for the individual, and it's about how do we reshape that and get them to meet that need in a more healthy and pro-social way. So often as you pointed out, often what is happening is they don't have the skills to meet the need in the healthy way. So therefore it's about how do we develop those skills and competencies and attributes, sense of sort of, that's healthy sort of sense of identity and those sorts of things that they're lacking to meet that in a more effective way. So it's often that there's a degree of lack in their life or a poor decision making that's leading to them choosing that path for offending. But of course, that's a very simple way, and it's very layered and complex because individuals are not just nice ingredient lists that we can just give them this quality and that quality, or this sort of attribute and that sort of attribute. Sometimes they have very pervasive personality issues, and mental illness as well can be coupled in there. So that's a nice framework to understand it, but it takes a lot of molding and reshaping, and it takes time, a bit like in the scenario around addictions and things like that. There will be setbacks, failures, so we need to really put a good framework and support system around them for when they do slip up and they do fail, so they don't revert back to what is known and what is comfortable and what is dysfunctional.
Yeah, absolutely. You reminded me of something early on in nursing, 2006, and just ever since then, which has kind of just shaped my interaction with every patient. The biggest variable in medicine is the human. It's the human being that you're working with, right? It's the biggest variable. You can do all the studies around all the medications you want or procedures or processes, but the person that's in front of you is a unique individual and they're the biggest variable in the whole equation.
Yeah, and it's that healthcare. I mean, it kind of sums it up in many ways for healthcare. Is it's exactly that, as you point out. It's we have great guides, evidence-based practices, but they always need to be refined and attuned to the individual.
Yeah, absolutely. So kind of interventions are perpetrator focused, and then you have your victim services, which are victim and survivor focused, right? And supporting both of those individuals.
Yeah, look. So I think, as you point out, we've got the safety planning aspect that's crucial with the victim, giving them effective strategies, moving inwards as well. I think is really valuable. So empowering the victim, and then the other aspect is about containing the behaviour to begin with. So containing the stalking, putting some parameters around that, and then how do we go about changing that? So the first thing is always safety, current level of concern. How do we mitigate the threat? Once we feel as though we've got that somewhat stabilised, then we need to start putting processes in place with both with our victim and our perpetrator, empowering the victim, keeping them safe, and perpetrator becomes about managing and trying to reshape and change that behaviour.
Yeah, absolutely. No, it sounds good. Well, I am so thankful for having you here today, Nathan. Thank you. You have a symposium coming up. I want to hear about that a little bit.
We have the Stalking Symposium, and that's an event I've put on, mainly around the fact that we are hopefully about to get a stalking law in New Zealand. We've been a little bit behind the times, so all things going well, we will get the new stalking law by the end of the year, which will be officially all approved in government. And the symposium is about, with the anticipation of this coming in, let's get all our key criminal justice practitioners together and talk about what this is going to mean and how we can improve our practices around stalking in New Zealand, and also learn lessons from other countries that have the laws and that have been doing it for a while, and then maybe put our twist on it and get it all localised and working nicely for New Zealand.
Yeah, no, that's why it's that uniqueness and that variability. I mean, every area, I've worked in hospitals all over the country, and every single one of them has their own culture and kind of way of doing things, and you absolutely have to put that spin and twist on it.
Yes, absolutely.
And then do you have a book out already or a book in the process?
I do have a book in the progress or in process. It's haunting me. I'm very close to being done, but it's the editing that is just ticking away, and sometimes I feel like I'm making no progress with the editing. But yes, on lone act of violence, mass casualty events, and looking at how we've had this upsurge in mass casualty attacks, particularly over the past decade, at a phenomenal rate across all sort of different countries, and trying to understand how we've arrived at this point and what the hell we're going to do about it, because it has an enormous impact on people, from victims all the way through to the police that are tasked with trying to stop these individuals. So I mean, it's having a devastating effect in many ways, and hopefully trying to come up with some answers and bring the issue to the forefront some more. So at some stage, hopefully by about the middle of the year, the book will be done and ready.
Awesome. Yeah, and the editing part can be, you can almost be your own worst critic. I feel bad. I started with a probing question and I'm kind of closing with a probing question, but I mean it's what I do, right? I talk to people and I get in there. So
Yes.
fantastic. Well, how can people get a hold of you or reach out to you if they want to get in touch?
Look, the best place to get in touch is probably at drnathanbrooks.com, which should be nice and straightforward through my website. Please reach out. Happy to answer any questions or any queries.
Okay, fantastic. And I'll make sure the notes or that link is in the notes and everything so people can reach out to you. So, well, Nathan, thank you so much. And I hope you have a wonderful rest of your day.
Thank you, Sarah Marie, and congratulations on the podcast.
Thank you so much.